Hi, it's Dr. Harris Meyer, chiropractor, downtown San Francisco, California, and I'm sitting here with one of my newer patients, Jackie, who started treating with us on September 21st of '09, and today's date is December 4th of '09, and we have done Jackie's first reevaluation today. She has had about 30 visits of chiropractic care. And Jackie, can you just tell us what were the symptoms that you experienced in the beginning when you first came in?
Most of my symptoms were really bad migraine headaches, and they all started right here, and it was like really bad throbbing pain here and down that caused arm numbness, and it would be something that was like all of the time. And then the migraine would come and last like up to 72 hours and then go away, but this pain here like never really went away.
And about how long had you been having those symptoms?
Since like on and off since I was really young, and we never knew what they were, and then in college it got so bad that I almost had to drop out of my first college.
And how often were they really coming up? I heard the 72 hours, they could last for that long, but about how often were you getting these symptoms?
Well, I was on medication that I didn't like, and that made it so I got them maybe like once a week.
Okay.
But if I wasn't on medication before that, I'd get them like concurrently, maybe like with a 1 or 2 day break, and then I'd have another one.
And we know that really regardless of what your age is, but especially at only 27, is that normal? Should you be having that? Okay. So, and how are things now? Just give me an idea. The headaches, how often, how severe, things like that. And we know that you still sometimes need to take medication because it's bad enough that you can't tolerate it, but you're not on the really strong stuff. You're now down to Advil, it is?
Yeah, well,
okay.
I stopped taking the daily medication when I started treatment here. So I was really concerned that I wouldn't show any improvement at all, because I thought that, I didn't know if I'd be able to tell, because I thought all the migraines were going to come back. Okay. And for the first couple weeks of treatment, I was getting, my migraines again, but maybe only like once a week, twice a week.
Right.
And then it started, the pain here was still there, but then the frequency of the migraine became less. So then they were just kind of just regular headaches where you'd feel it sort of all over instead of just the real bad pain right here. And now I get headaches probably, well, I haven't had one in like a week and a half. But then before I was getting them with, I don't know, once or twice a week, but they were just regular headaches, and just regular Advil would help it.
Okay, so we know there is no such thing as really a regular headache, but well, I understand what you're saying. It wasn't a migraine.
In comparison.
Okay, so things are substantially improved.
Yeah.
And how about the symptoms in the arm?
Well, the numbness has gone away. It used to be like a precursor to the headache pain, and now like my pain in my neck, I still get sore, but the pain that used to happen like right here, up in this area, is not. It's not the same anymore. Like, it's more just like muscle soreness as opposed to feeling like someone's like drilling something into my head.
Okay. So if you can just tell me the thing that prompted asking you to do this testimonial today was that today you just volunteered information to me about how you're doing with school, because you work full time and you're going to school and you're at finals. Yeah. And so what was it that you...
Well, normally at finals, like 2 weeks before, I have to like map my workout and then plan on everything taking up to twice as long, because I have to like account for migraines since I don't sleep. And so if I get a migraine, I make mistakes in my work and I have to go back and fix them, or I have to sleep, and that's something that I don't normally get an opportunity to do. So I can say that my finals on Sunday and I am done with all of my work, and that's really cool.
And so, okay, not having a headache for a week and a half, I think is what you said.
Like a week and a half.
Okay, so things are going much more smoothly right now, and you're getting through this time a lot more easily.
Yeah, much easier.
Okay, excellent. Anything else that you wanted to add?
Nope, pretty stoked about it though.
Thank you so much. I really appreciate it, and you're an awesome patient.
Yay.